Today's video is about ESR. ESR is a lab test. It's erythrocyte sedimentation rate. It gives you an idea of how fast the erythrocyte is sedimenting down in a column of your blood. So it's just a measure. It's an indicator. It's not a disease. A high ESR is not a disease. A high ESR is an indicator of a disease, and it doesn't have to be. So in your lab test, you'll see your ESR results between 0 to 20, and anything about that is abnormal. You don't need to panic when it's about 20. If it's 20, 25, 27, 30, you don't need to panic. Usually you start worrying about it when it's above 40, 50, and it's consistently above 40, 50, because there's lots of reasons for why your ESR can go up. It can go up if you're anemic. If it can go up if you've got a thyroid disease. It can go up if you don't have enough protein in your blood, albumin in your blood. It can go up if you've got a fever, a cough or a cold, a urinary infection. If you've got diarrhea, any of those infections can cause your ESR to go up. And once it goes up, it stays up for a few days and then it comes down. It usually takes 2 weeks for it to come down. So if you see ESR high, you should think back and look back on the last 2 weeks and see if you've had any illnesses that is causing it to stay up. And if you see it high, then you can check it 2 weeks later to see if it is improved or not. You don't need to obsess about it. It indicates that you've got an illness, and what you should be worried about is to find out what that illness is. That's all. You don't need to treat the ESR itself. The ESR comes down when the disease goes away. So it can go up if you've got lots of diseases. So it's up to the doctor to investigate. So you've got to look at all the other symptoms and signs that the patient has, and then decide what is the most likely source of the infection or inflammation, and then investigate what's causing the ESR to rise. So you don't need to check it all the time. If you're ill, you check it and you watch the trend. The trend of the ESR is more important than the actual single number. So if you got a high ESR and it's coming down every 7 days, then something's getting better and you need to stop worrying. If you've got if you got 20, 25 and you check it the next week and it's up to 35, and the next week is up to 45, then something's going wrong. ESR varies day to day and even from time to time, and it varies according to how the blood is drawn. It varies according to what apparatus is being used to collect the blood. So all of that affects ESR. So a minor variation is not a problem. If it's consistently going up, then it's a problem. If it's coming down, it's not a problem. So you need to check it maybe once a year along with all your other blood tests, which is a good idea anyway. Checking your blood tests every year, once a year, is a good idea. Check it if you're unwell, and you can watch the trend of it, and that's how you use the blood test ESR. It's a very cheap test. It's easy to take. It's done in all labs. So it's a handy test to have. Just that you need to know how to interpret it properly. There's no medicine to reduce ESR specifically, and you don't need to reduce the ESR specifically. You just need to treat the disease and the ESR will reduce. So that was about ESR. If you've got questions, ask me in the comments and I'll try and put up a follow-up video. Thank you.